I am Bruce Stevenson, and I am part of Today's Dental Consulting. We only work with offices using or switching to Open Dental. However, we have no affiliation or financial ties to either Open Dental or any other vendors. In this video, we're going to talk about limitations, exclusions, and actually using your UCR fees for contracts when you're in network with a plan. Okay, you signed the contract. You're responsible for what's in it. And different plans have lots of different stipulations. You need to be sure that your plan allows you to do some of the things that I'm going to show you in this video, and many plans do. And when you don't take advantage of that, you're actually losing a considerable amount of money. Okay, how do we navigate to get into these areas in Open Dental covering insurance? If we're in the family module, we're going to then click over here. This is the insurance section. Double click in there, and then going to go down here. This is the screen that's going to pop up. We're going to double click here again, and that's going to take us to this screen over here. This is where we can go in to edit the different limitations. Going back to the family module again, double clicking where we did before, and then going up here to this other benefit. So instead of going down here and double clicking, we're going to go up here to this other info screen and click on that, because that's the way we're going to get to information that we're going to use in here in a few minutes. So let's talk about category percentage versus PPO percentage. These are the two plan types in Open Dental. And we've always preferred category percentage. I'll tell you the difference in just a second, because we think it's easier for both the staff and the patients to understand. We also find fewer human errors in offices that are using category percentage. In category percentage, it's your contracted fee that's going to show up in the patient's ledger. Okay, now that's your contracted fee, not your UCR fee. With PPO percentage, it's your UCR fee that shows up in the patient's ledger, but Open Dental creates another column over here that we didn't have with category percentage, which shows the difference. It automatically calculates the difference between your contracted fee and your UCR fee. The amount that shows on the patient's ledger is the UCR fee, and then the discounted fee takes that down to your contracted fee for that particular plan. In order to use the exclusions that we're going to show you, you must use the PPO percentage rather than the category percentage. In either case, category percentage or PPO percentage, the fee that appears on the insurance submission is the UCR fee. You always want your UCR fee on the submitted claim. So what's the difference between limitations and exclusions? Limitations are things like frequency limitations, so you only get 2 pro fees in 12 months, or maximum, annual maximums. Exclusions are things that are never covered. They're specifically not covered by the insurance plan. For example, porcelain veneers. For limitations, we're going to go to that Edit Benefits screen that I showed you previously. And here's all the limitations that Open Dental puts over here for you. You can actually edit this and add other ones. And in the case of a pro fee, it says 2 per benefit year. Now make sure you change these things when you set them up. Okay, down here are the exclusions, and we're going to come back and talk about those in just a minute. So excluded procedures are never going to be covered, and there's a couple different ways that you can handle this. One is to mark the procedure as do not bill insurance. And the other way is to actually set up an exclusion, and how they're handled within Open Dental is different. To mark a procedure as do not bill insurance, we're going to go up to lists and then procedure codes, and then we're going to enter the procedure that we're interested in. In this case, it's a porcelain veneer. And we're going to check this little box right down here. By default, this is not checked. We're going to say, okay, for this procedure, do not bill the insurance. Now you can later override this in a specific case, but this is a global change for this procedure in here. And what's going to happen is in your treatment plan, this is going to show up with an X in here about the allowed, because you're not going to send this to the insurance company. And so as a result, it's going to put your UCR fee in here, not your contracted fee. That's one of the differences between do not bill insurance and an exclusion. So here, this is an exclusion we're going to come to in just a second, and that's still putting our our contracted fee in there, although we're going to change this pretty soon. Now we need to talk about global settings versus plan-specific settings. Keep in mind that your plan-specific settings will override the global settings that we're going to put in here. So we're going to give you several different examples in here and show you how the setup affects each one of these. So here's our porcelain veneer again, and this is our treatment plan down here. Now, because we said don't bill the insurance, puts that X there, it's going to put the UCR fee. If we did not check that box, then by default it's going to put, remember, the discount in there. So your actual fee is going to be considerably less. And it's also showing in here that the insurance is going to pay for that veneer, and we know that's not true. So now let's talk about exclusions in here. And in this case, we're going to put in a bone graft, which sometimes the insurance does actually pay, but most of the time they don't. In the case of exclusions, we have to go down to our other benefits. We're in the edit benefits, where we have to click down here and add one. And this is the one that I put in here for this. This is a ridge preservation code in here. And I said they're not going to pay anything in there. Now, you need to be careful in setting this stuff up. And what I suggest you do is to go into your user's manual and look up other benefits. And in that other benefits category, it gives you a whole bunch of examples. I think there's 12 different examples in here. And you can just copy the setup for the example that fits your particular situation. So rather than trying to remember these different things, just go in and do it the easy way. Just pull it right out of the manual. So let's get back and look at our edit benefits in here, and here you can see that exclusion for that specific procedure code. You can also do groups of procedure codes or range of procedure codes or even categories in there. But when we do that and we say, okay, they're not going to pay, we don't think the insurance company is going to pay anything. However, it's still going to show your UCR fee over here, even though the insurance is not going to pay anything in there. It still puts that with them, because we have to use PPO percentage in order to have these things come out right. And it's going to put that discount in there. So we're still just dealing with UCR fees. We're going to come back and change that fee in just a minute. But first we have to talk about global changes versus plan-specific changes. So to go to the global changes, we're going to go to Setup and Preferences. There's lots of stuff in Preferences in here. And we're going to go to Family General, and there's Insurance right down there. And we're going to look at this window right down here. By the way, here's the UCR fees show on your claims. You want to make sure that box is checked. By default, these boxes are not checked. So if we go in and say, yes, do use the UCR fees and apply it to the maximums and apply it to the frequency limitations. And that's what we want it to do, and we'll see what the changes are in just a second. When we check that little box in our global preferences, now this automatically puts that UCR fee instead of the contracted fee in there, because that's what we told it to do. Now I went back into preferences and changed it back to the defaults. So if we just left this alone and didn't make any changes in the plan in here, then it would go back to using our contracted fee. So what we're going to do, we're going here, more information, remember how to get there, and going to go down here, and this is what it looks like generally by default. Okay, and what we're going to do is change those things over here. So we're going to say for exclusion, same thing we did with the preferences, except this is the plan level. So this will affect everybody that has this plan. We're going to tell it to use our UCR fee. We're going to tell it to apply that to the maximums and to the limitations. Okay, when we use these settings, then we can look in here and say, aha, now our bone graft is back at our UCR fee. But look what's happened to the pro fee in here. Remember the pro fee before, even though the patient had to pay it because it was the third pro fee in 12 months, they used to pay the contracted fee, and now we've changed that. And we said for limitations up here, use the UCR fees. And so now that's jumped up over double what it was before. The advantage of this is it's all done automatically for you in Open Dental once you set these things up. So you don't have to go in and edit each individual line item in there. This is all taken care of for you. So what we talk about, understanding your contract. That's you're going to have to do by yourself. I'm not going to help you with that. But then you can decide how you want to handle the limitations and exclusions, and specifically how you're going to make global changes or specific plan changes and how those affect different procedures. So the last thing is, do you want to use your UCR fee for those excluded or limitations, or are you going to use your contracted fees? Not right or wrong, but using UCR can potentially increase your profits. This is an example of how Open Dental has a lot of hidden features that, when properly used, can really influence your practice profitability. If you have questions or would like some help using some of the more advanced features in Open Dental to help your office profitability, contact us. That's what we do. You can schedule a free consultation by just going to our website, todaysdentalconsulting.com, and clicking on the self-schedule link. We'd love to talk to you.